Okay, great, perfect. So let's start our webinar about Life Expert Profi. I can talk about Life Expert Profi, I don't know, for a few weeks every day we can talk about Life Expert Profi. So please don't wait that we will talk about everything in today's webinar. So I will do a series of different webinars about Life Expert. One second. Okay, there is no avatar, but it's not a problem. Let's continue our webinar. My name is Karina Wyszymirska. Everyone who wants to have this presentation after the webinar finishes, you can write me your email address and I will pass you the presentation in PDF so you are able to check everything, because there is a lot of information and I won't be able to explain everything and to talk about everything at a time. I will give you examples, but if you will have any questions, you will be able to get the presentation in PDF. Let's talk in general about Life Expert Profi. What is Life Expert Profi? So we have two devices. One of them is Life Expert, another one is Life Expert Profi. And we have our new cloud version of the application, Web Wellness, which is very awesome and where you can switch between two modes, Life Expert and Life Expert Profi. Life Expert Profi device can be used in both modes, which is Life Expert for particulars. It's more for people who are not doctors, who doesn't understand anything about medicine, about doing express testing, about bioresonance testing, who only want to do rapid tests and to see briefly their results. And Life Expert Profi gives us much more opportunities and has much more different features. A part of express testing, you can do drugs and supplement selection, food intolerance testing, electroacupuncture according to Wall and Vega test, bioresonance therapy. And this mechanism has a unique self-improvement system. More tests you do, more accurate and better the results you will get every time. So it's very useful to have a big database of the patients in the diagnostic, and this way to approve the application. You can get the reports about overall conditions and risks for major systems, causative factors, diseased organs and systems, probable diagnosis, zodiac diet, food navigator, spine, auragram, chakras, skin projections according to Zacharian head zone, physiological age with identification of adverse effects, heavy metals and vitamin deficiency. In today's webinar, moreover, we will not talk about analysis about the reports, because we will need to start off how we can do a measurement, how we can do it well. And to know how we can do it well, we need to know what we will be measuring with our Life Expert Profi device. This is a segment diagnostic. It is very important to understand that we are not measuring single organs. We are measuring segments. And how do we know about segments? We know about segments because of a famous Chinese doctor Nakatani and Dr. Wall. They found out that the body consists of different segments. We measure them through the vegetative nervous system in our diagnostic. Segmental diagnostics uses the fact that underlies the vital activity of all animals and humans, the principle of a segmental structure. Segments have separate nerves, roots, sensory and motor, which are located disc-shaped and consistently in the upper part of the body. And in the limbs, they are oriented longitudinally. Skin segments are associated with internal organs, nerves, through the divisions of the automatic nervous system, which we measure. That's why I marked it with blue, which formed the basis for their comparison. Their measurement is carried out in 6 square leads. This is a method of Dr. Wohl, German Dr. Wohl, and it gives us the opportunity to get the information about 9 systems and 47 segments of the human body. We will start use this methodology, segments, because we are measuring segments. This is very important to know and to take into account. Now let's see which information can give us a segment. A segment, it's a very big plot, so we can get a lot of information out of it, such as information about specific organs, systems, on the specific part of the body, vegetative nervous system, spinal cord, vessels, and intercellular space. This is very wide. On this picture, I would like to show you which segments we measure. So please, here you can see the segments which are used for our segmentary diagnostic. Let's take a look at the picture of a human and read these segments. I have put them on 2 pictures because it's impossible to put so many information to one picture. So here is the second one. They seem very similar, and basically they are measured as you can see on the picture. Let's talk, for example, about a segment. The first one, left forehead, left hand. The information flows both ways. So we measure information from left forehead to left hand, and then from left hand to left forehead. And the same way with all the other segments. The information is measured as you can see on the pictures. Also, let's pay attention how many organs and systems enter to each segment. For example, left forehead, left hand. We measure in this segment central nervous system, left eye, left ear, left frontal and maxillary sinus, cervical spine, tonsils, upper jaw teeth, left heart, upper left lung, nerves, vessels, and joints of the left hand. This is a very wide segment, as the other segments as well. So we need to take into account this is a very important information, because sometimes when we run a test for some people, the information and how we read this report may vary from this knowledge that we measure segments. In my future webinars about Life Expert Profi, which I will continue doing, I will explain this information to you, why this is so important. So in the presentation I will pass to you, you will be able to read all the segments and to have this information always with you in case you need to return to read it again. So we all know that biochemical and biophysical reactions in our body are accompanied by electromagnetic processes. So during our test, we measure these electromagnetic processes in the body. What does it mean? What are these processes? These are the functional state of organs and system, the state of the immune system, the state of the vegetative nervous system, the state of body tissues, physico-emotional state. And also we need to remember that during the test, when we're measuring, the human body receives background test electric current of 12 microamps with a voltage 3. Why it is important? It is important because the diagnostic, of course, has some contraindications, which we will talk about right now. We need to understand that we give an electric current to our patient, even though this is a small electric current, but we give an electric current. So let's check our contraindications. Contraindications, there are just 5 of them. The first one, if the person has a pacemaker because of the possibility of contravention of his functional abilities. Some people, even though knowing this, may think this is not so serious. I want to do a test for my patient who has a pacemaker. but I truly not recommend it, because this person, if something happens to him, because we give electrical current and the pacemaker is also a device, if something happens to him, the first person who he will think about will be the doctor who made him a test, even knowing that pacemaker is a contraindication. The second contraindication is that the patient has a pathology of the skin in the measurement areas. Those zones which we connect the six lead head, feet, and hands. If the person has some skin pathologies in these areas, if it's, for example, one small pimple on the forehead, we can always move the electrode a little bit to the right. We can avoid this small pimple. But if this is a pathology and the skin is covered with some things, it is not recommended to run the test until the person cures a little bit these symptoms. The third one is sensitivity to electrical current and mechanical pressure. If you start running the test to person and the person feels discomfort or pain during the measurement, it means that this person is very sensitive to electrical current. To be honest, I have never had such experience. I'm not a doctor, and all this information I'm telling you, I'm retelling the words of the doctor who works with our equipment. So I have prepared very well for this presentation because I really wanted to share it with you so you also know this pressure, this information. So this is not a common situation, but it may happen. Just please take it into account. And the fourth one is resuscitation. For example, if the person feels very bad and instead of calling ambulance, you want to make a test for him, this is the wrong choice. First, you need to call ambulance. First, they need to give him the first aid help. And then when the person feels much better, you can run a test and to see what has happened. Or you can run a test before the person feels so bad. But if it's a critical situation, the priority is calling the ambulance rather than doing a test. This will be much more useful for the person in such condition. And the fifth one, if the person doesn't have a hand or a leg in this case, because without a head it's impossible to live. But if the person doesn't have arms or legs, we cannot measure. Some people are asking, and what if I connect it with something to the zone where his legs were located? Or what if I try to do this? We can try anything, but we cannot guarantee that the measurement will be done well, because this principle was made specially to connect to the 6 active points, which are head, hands, and feet. And if something is not there, then we are not able to run this test. The next important information before we run the test is how to prepare our patient. I was explaining as well in our webinar about Life Expert, but here, since we are talking about Life Expert Profi, I went deeper and I have prepared a questionnaire which you will be able then to download and to send to your patients. If they go for a test to you, you can send them this questionnaire. And they will know how to be prepared for the test. It's not that you need to retell everything. You just send it to the person reads it, and that's all. So it's very important to not use the shower gels because they affect on electroconductivity of the body. They can change our properties. On the day of diagnosing, do not apply cosmetics and creams. Especially this is about women, because women can come with a lot of cosmetics. In this case, we will be able to clean the face, but it's better to come before you put the cosmetics and cream and not doing that. The third one, at the time of diagnosing, the patient should not be hungry, but at the same time, you shouldn't have breakfast and in 5 minutes run a test. Perfect time is 2 hours before the test, but if you do it in the early morning and you cannot physically do it 2 hours before, you just have a light breakfast 1 hour before the test. For 2 or 3 days before, it is not recommended to drink alcohol. The day before, do not drink coffee or strong tea or do not eat spicy food. It is also very important. Right before, do not eat chocolate, citric foods, and do not chew a gum. Medications that can be cancelled painlessly that are not so important for the patient should be stopped 1 day before examination. If this medicine is very important for the life of a patient, you need to continue taking them as was prescribed by your doctor. The next Okay, so let's continue our presentation. You need to exclude contact with chemically active substances like varnishes, paints, solvents, acetone, alcohol, gasoline, 1 day before doing the test. Do not smoke the day before if it doesn't cause stress to the patient. If it's very stressful, of course, we cannot tell people not to smoke if this is necessary for them. Clothing is preferable from natural fabrics. Before diagnosis, it is necessary to remove all the jewelry and metal objects from the body and turn off the mobile phone or remove it at a distance of 1.5 meters. It is not advisable for women to be examined during menstruation. And also, before diagnosing, wash your hands with the soap and water. If this is winter time, also it is suggested for women to put the comfortable clothes, for example, jeans and socks or some trousers, because the feet electrodes, you need to place your feet and you should take off all the shoes. You need to be bare, like bare feet. Okay. What else can influence on the measurement? We need to know about this. The condition of the central nervous system of the person, his emotional state, skin, and external factors. I see that my presentation is not displayed very well, so I will read it from my laptop. And then when I pass you this presentation in PDF, everything will be fixed. There are some characteristics which can influence and they can reduce the measurement indicators. These are degeneration processes. Some chronic intoxication can reduce the results of the measurement. Some circadian rhythms, for example, depending on the person, if the person is used to wake up very early and feels well, or if the person is used to wake up very late. So in this case, when you do a test for a person whose circadian rhythm is old, it's a bad idea to put him at 7 a.m. It's better to put him during the lunchtime or in the evening. And opposite about lark, it's better to put these people who are used to wake up very early in the morning, because they will feel better and the results will be better displayed. Also, some factors which can reduce the results of the measurement. Some chronic diseases with tissue degeneration processes, lack of sleep, hormone deficiency, overwork and exhausted condition, long medication, like antibiotics, for example, and taking stimulants and tranquilizers. This all can influence on the person. And the second part, which is not shown here, I will read it from my screen, from my laptop. Factors that increase measuring indicators: high temperature, because high increase in measuring indicators means hyperfunction, those red and orange colors in our diagram. So this is high temperature, stress, inflammation, emotional and physical stress, taking stimulants, medicine or drugs, or smoking. This is also has a bad effect, but the effect depends on a dose which was taken. If you do sport, running and squatting especially, it also increases the indicators of the measurement, and acute intoxication also increases the measurement results. How we need to prepare ourselves and the person to the test. Let's see this test procedure. First of all, we need to locate ourselves at the table with the device. The best location of the patient is in front of the doctor. No one should sit or stand nearby the patient by his side. The patient and the doctor should be in front of each other. First of all, we go to registration and we register a patient. Such characteristics like age and sex are very important for the measurement, because the norm corridor for different organs and systems varies depending on the age and sex that the person has. It's very important. Some people do not want to put their real name. Okay, they do not want to put the name, they can put some username they are used to be called. But the age, so the date of birth, the age, and the sex should be put correctly, because it affects a lot on the test results. And when we register a patient, we have a small space to write the notes over there. When we write the notes, we need to ask the patient about how does he feel, question him. It is very important to ask, did he have any surgery before? Or does he have any serious disease such as diabetes or cancer or high cholesterol or some problems with tension or allergy reaction? Because these are things which have a right effect on the diagnostic report. Does the person have any complaints right now at the moment of the measurement? And if it is a woman, you can even ask, did she give a birth? It's important. And the question about the surgery. We need to ask about the surgery because there are some situations when the organ was eliminated. The segment, when you do a diagnostic, will not disappear if the organ is not presented. We will see this segment on the diagram because, as I told you before, and I told you that the fact that we measure a segment is very important, and one segment has different tissues inside, nerves, canals, blood vessels, hormones. It's a structure. It has muscles around. So it's a big structure. So if the organ is not presented, it was eliminated, but we see this organ on a diagram as green, it means that this segment is all right. The organ was eliminated, but everything is all right. No problems with this segment. If the organ was eliminated but it shows blue or red, it says about hypo or hyperfunction of the zone. Blue hypofunction, red hyperfunction. Further, we will talk about these measurements, hyper and hyper, more in details. The next step is to connect a patient to the device electrodes. It is very important that the electrodes should not cross. The forehead, the hands, and the feet of the patient should be clean. You need to remove excess sweat, makeup, and creams if such presented. What should we use to do it? Just simple water or what? For example, We recommend to use for oily skin solution of 50% of water, 50% of medical alcohol. These are the proportions. If the skin of the person is dry, so 50% of water and 50% of hydrogen peroxide is recommended to be used to clean the skin of the person. It is very important to wet the palms of the hands and the feet. On the floor, it is recommended to put a towel or a small carpet like those that we use for the bathroom. And they should be easy to wash. This is just for your comfort because you will need to wash these carpets. Why do we need to cover the floor? Because, for example, if your floor is made of some stones, they also have their frequency, they also can interfere with the test. So it's important to place a towel, but it's more comfortable if you put a towel or a small carpet anyways, not depending on the floor you have. Electrodes should be washed in the soap solution every time you have another patient. So with each patient, you need to wash them. It is very important because otherwise the information of a previous patient may be presented in your test if you do not wash it well. Do not take measurements if the surface of the skin on which the electrodes are applied is irritated and has some pathologies. Repeating the same information I told you before. The table should be made of wood or plastic. If it is made of metal or glass, please cover it with a tablecloth. The same situation as with the floor. Before testing, it is necessary to remove all the jewelry, metal objects, and mobile phone should be 1.5 meters away from the zone where you will be testing the person. You need to ask the person to relax and to close his eyes. It is very important. If he does not close his eyes, you will be measuring his reaction to the outside factors. So you will be measuring the things that the person are looking at the moment of the measurement. But we need to measure his inside factors, his health conditions. We need to see the real results. So it's important to ask the person to close his eyes. Then we go to rapid test and do the measurement and send it for processing. Once this is done, we need to do harmonization. I will explain you why we need to do this harmonization. You go to bioresonance therapy and do harmonization. You choose a unit meridian. I will explain you how to choose it. You choose duration of this harmonization therapy, and you click on the control button and then start the test. A patient can leave the eyes open, and during this therapy, he can even talk to you. It's not so important. This is just a therapy. So harmonization, why do we do it? We do it because the first test we do to the person is a stressful test. The person comes to us the first time. He doesn't know what will we be doing to him. He doesn't know anything. He has some expectations and he wants to have very good results. And this is a stressful test. By doing harmonization, we help him to relax and we stimulate his organs and systems to do the comparison then after one test, which was done before harmonization therapy, and another test which was done after. I will be talking to you later on about indicators we use for reading the test, and one of them is lability. And we need to see the lability, how our organs and systems respond to changes in the body. And this change in this case is harmonization. So when we do harmonization, we need to click on the control button and then start a test. By doing control in harmonization, the device is reading the patient information and matches the signal with him. During harmonization, all the cells of our body are activated with a current of 10 gigahertz. Once we do harmonization, once it is done, we ask him to relax, close his eyes again, and we return to rapid test, and we run the test again. This is a test we will be using for reading, because the first test we give, it's like a false information. Because as I told you before, the person is not prepared. He may be stressed. He may have some expectations to this test. And the second test after harmonization is our true test. If you do not want to do matching preparations after doing these two tests, matching food, if you do not want to test any supplements, then our test is done. Congratulations, we can go to analysis section and to read our report to the client. I will explain you some indicators which we use to read this report. Everything is very easy. Let's first look at the picture, how the person should be connected. Our electrodes, on one side, each of them has a red sticker. What does it mean? The red sticker should be on the right side of the body of the person. If this is a head electrode, right side of the head. Hand electrode, right hand. Feet electrode, right feet. It should be marked with red. This is an indicator. All this information, all these pictures are also presented, how to connect the person and how to use the application. Inside the Web Wellness application, we have user manual, where you can read all this information as well. Let's talk right now about some things which are more serious. These are indicators we will be using to read the report. I will show you real quick how our diagram looks like, so you can take a look. We will be talking about these diagrams about organs and systems and the indicators we use to read them. For Life Expert, you only need to look at the color. If it's green, this is good, blue or red, this is bad. But in Life Expert Profi, we have many more indicators to use to be able to read the test. Let's talk about them. In order to properly evaluate the results, we need to talk about these indicators. The first one is fall phenomenon. This is not a phenomenon of a drop arrow, as the one which is presented in Vega test and the Vol, where you have a small screen and the arrow can drop. This is a different one. It's much easier. This is just for our segmental diagnostic rapid testing. This is a different phenomenon. What does it mean? It says that there is a self-induction mechanism in the body and that the body itself produces some frequency. Our organs and systems produce the frequency, and that the body has gone out of control of the central mechanism of regulation and the pathological processes develops in it. When we do not need to take into account this indicator, when fall phenomenon is 0 or 1. In this case, we do not take it into account at all. But if it is from 1 to 4, we can talk about compensated processes. So there are some processes, some changes. Our body, our organ, our segment started to produce some frequency itself, but this is compensated, and our organism may work on it itself, may fix it itself without our help. Maybe yes or maybe no, but normally yes. If the fall phenomenon is from 5 to 11, we talk about some subcompensated processes. What does it mean? If the organism is strong, the compensation for this process may occur, like in the first situation when we have compensated processes. But if the organism is weak, then instead of compensation and recovering, we will go to the 12-21 stage of fall phenomenon, which is called decompensated processes. They are non-reversible organic changes, but if they are more close to 10, if it's until 15, we can give it a chance. There is a chance to adjust it. If it's more close to 20, then no. And if fall phenomenon is 22 and higher, this is a complete disruption of compensation mechanism, irreversible destructive changes. Okay, so let's look at the picture and let's find fall phenomenon. In our diagram, the fall phenomenon are those gray numbers which we can see on the right. 5, 7, 6, 7, 2, 2, 3, 10, 9, 2, 7, 2. So in this case, as I told before, from 0 to 1, it's okay. From 1 to 4, compensated. From 5 to 11, subcompensated. From 12 to 21, decompensated. And from 22 and higher, complete disruption. So on this example, I show you cerebral blood circulation on the right, number 5. Fall phenomenon is 5. So it's subcompensated process. Also, it is described here when you can see it as a gray number or as a gray part of a column. So every measurement has like a gray tail. So this gray tail is also a fall phenomenon. Another indicators we have are the next. So one of them is side effect. Side difference, we consider it only in paired organs. I mean these organs which have right and left part, paired organs. Those which have these parts. Some unpaired organs and segments can also be compared by side difference, but we will talk about it on our next webinars. This information is deeper. Right now, let's just think of paired segments. Paired segments of the right side and the left side. We are comparing them one with another one. This is a difference between the left and the right side of a segment. It tells us about the presence of unilateral problems in paired organs. Unilateral means in one of the parts. If the SD, side difference, in a paired organ is more than 5, this indicates pathology problem in this organ or in vertebral interest. What is an vertebral interest? It's very easy. If we see a lot of blue colors, a lot of hypofunction, let me show you what is hypofunction. Here on this picture, everything which is down below normal, mild hypofunction, moderate hypofunction, significant, and florid hypofunction. So if we see a lot of blue colors, a lot of hypofunction in our report, it means that we need to, and if we see a lot of side difference, of course, between the paired organs, we will definitely need to look if the person has some problems associated with the spine. This is called vertebral interest. So let's remember, everything is blue and a lot of side differences, more than 5, we need to ask the person about some problems with his spine, with vertebral column. This is pretty easy. So this is a theory, for example. If we have a problem with the organ, it will be presented in our spine. And the same theory, but another way, if there is a problem in the spine, it will be presented in the organ. Oops, sorry. The other two indicators are lowest value and highest value. Lowest value is for all segments in the hypofunction corridor. I marked it with purple because purple is basically the last stage of hypofunction. So if we see a lot of blue corridors, if they are presented, and we need to find the lowest value in these segments. If the segment column is within 40% of the norm corridor value, then these deviations are reversible. If more than 40%, then this indicates irreversible processes occurring in the organ. So right now, when we will go back to the diagram, I will explain you what is the norm corridor value and how to look at the lowest value. The highest value is the segment with the highest value of the hyperfunction corridor. I marked it with orange and red because these are the colors of this corridor. Let's open a diagram. I will show you side difference, lowest value, highest value, and norm corridor. Let's see, here you have a norm corridor. So basically these green lines you can see below each organ and system for different organs and systems for different segments. Norm corridors are different. I will prepare a document for those who are interested with these numbers, because basically we have numbers from 1 to 100 of the different results. And the norm corridor is marked here as green. So if these blue lines decide to grow, and they grow until the green lines different for different organs and system, it means they will be in their normal corridor. This is norm corridor. Side difference. Let's look at number 3 and number 4. These are paired organs because we can see venous system, right cardiac zone, arterial system, left cardiac zone. So basically those organs which have right and left part, they are paired. We have organs which do not have these parts. So they are not paired and we do not check them on this indicator. So side difference between them, we need to look at these blue numbers, 49 and 32. The difference is 18. The difference is pretty big. As you remember, I have told you before that this difference should be less than 5 for side difference. Then here is also presented lowest value. Among all the numbers, we can see that the smallest number is 16. This is the lowest value, and we need to pay special attention to this organ, hypothalamus. The highest value is not presented here because everything we can see is blue. Why we only have 13 organs and systems? Because I couldn't take a picture of everything and put it here so you can clearly see everything. So I decided to make it just so you can know how to read it. I took just 13 organs and systems. So the highest value is not presented because we only look if it's hyperfunction, if it's yellow, orange, or red. Lowest value is presented is hypothalamus. Norm corridor are those green lines we can see on the picture. Side difference we can calculate it between the paired organs. It should be less than 5. And fall phenomenon, we have already talked about it as well. These are those gray columns. The last indicator, but not least, is liability. I have told you that we run one test, then we do harmonization test, and we do the second test, and we read the results from this second test. Why? This is connected to liability of organs and systems. Liability is the ability of the organ, or a segment in our case, to adapt. All the situations that happen to us in our life lead us to the same reaction. Doesn't matter if it's happiness or stress for our body. Happiness is stress for our body. Pain is stress for our body. Some negative situations are stress for our body. Some good situations are stress for our body. We talk stress. When we read some books, this is stress. When we watch TV, this is again stress. But stress, it's not always bad. Stress is normal for our body because this way our body adjusts to the circumstances that surrounding us. That's why we do two tests. The first one is a stress test, after which we conduct harmonization, on which the body should respond. Every test, if there is no change, no reaction to the stress, our body runs out of power and it cannot adjust itself to the circumstances that surround us. Even the temperature difference is a stress for us, and our body should be able to respond, to change the properties in order to survive. And that's why we need to measure this liability indicator to see if our organ can adapt or no. If the organ does not respond to our harmonization, it stops adapting. It is indicated by the presence of morphological abnormalities in the organ and a decrease in the reservoir of adaptation. If the organ after harmonization has not shown any changes, it indicates the presence of pathology in this organ, because liability is an obligatory reaction of the organism on the stress so that we can survive and adjust ourselves to the changes of the circumstances in our life. This is very important. Let's return to our diagram. In our diagram, you can see marked with the red color, there is no liability. Why? Because we are not comparing the test. This is one of the tests. We do not know if this test was made before harmonization or after harmonization. In our new program, you can compare them all on one page very easily. And if you do the first test, harmonization, the second test, you need to open comparison mode. You need to choose the date of the measurement for both of them and compare them. These numbers, which are colorful on one and another test, they should vary. After harmonization, they not always become better. It's not supposed to be better. They can become worse, but it's not a problem. In this case, it means that our organism has relaxed during the harmonization, and we could see the real picture of what is going on with the person in his body. 19. So basically, these are the ranges we can see from normal to hyperfunction and to hypofunction. It's all also presented in your application Web Wellness. Also, the colors can have different interpretations depending on what they mean, if this is a hyperfunction, normal range, or hypofunction. You can see everything on the screen right now, and those who would like to have, you can take a screenshot if you want to save it right now, or take a picture with your phone, but those who want, this video is recording, so it will be posted on YouTube and you can watch it again and again, and I can send you this presentation in PDF. What processes reflect in the column diagram? The processes occurring is in the mesenchyme. It is the matrix or the that integrates the body into a single structure. It is connecting the whole organism. Literally, all processes take place into mesenchyme. Breathing processes, slag, toxins emissions, hormone exchange, exchange of enzymes, everything is processing there. In this system, the whole life organism takes place. This is a matrix of our body, and there are fibers of the sympathetic, parasympathetic, and metasympathetic nervous system in this matrix. They control the adaptation processes of our organism, and we take the measurements directly from there, from the mesenchyme, from our matrix. Okay. I was talking a lot about harmonization, but you may have a lot of questions. What is harmonization and how I do it? So it's located in the bioresonance therapy section of our Life Expert Profi mode. once you do the first test, you return to bioresonance therapy to run a test. But I forgot to tell you one very important thing. Let me return to our preparations. So test procedure. Here, I forgot, it's written here, but I forgot to tell it to you before I go to the rapid test and do the measurements send it for processing. Go to the general conditions of systems, our analysis, the first one, where we can see our resistability to the outside factors, our pH, and here we can see the type of a nervous system, parasympathetic, sympathetic, or eutonia. So when we do the first rapid test, in order to do harmonization, we do it depending on which type of vegetative nervous system does a person have. That's why after rapid testing, we need to go to analysis, general conditions of systems, go down and to find a type of nervous system of a patient.